Now we look at an integrative perspective on counseling practice. And the integrative perspective really is, of all the approaches, probably the most challenging, because it asks us to look at all of the approaches and what might be learned from all of them and how you can utilize them in creating really your own counseling stance and your own counseling approach, which is unique to you. I want to begin by saying, don't be impatient with yourself and think after one course and having one course in theories of counseling and theories and techniques of counseling, you'll be an expert and that you'll have your own integrative approach all put together and down. It's going to take years and years of training and practice and supervision and talking with colleagues to hone and shape and fine-tune an integrative approach, if that's what you're interested in. And why I have this as one of the last chapters in the book is because most therapists today acknowledge themselves and view themselves as borrowing from more than one therapeutic approach. Today, the most common therapeutic modality is probably integrative. It used to be called eclectic, but I think that term is a little bit passé, and now we use the term integration more. There are different pathways towards integration, and why I think an integrative approach is useful is because different clients need different things and different approaches. And if I'm riveted to one approach only, and I can't think of how I might use techniques or intervention strategies from other approaches, I might be limited if you, the client, need something different than my own particular theory. Now, that doesn't mean that everybody should be an integrationist. You might say, I'm primarily a reality therapist, or I primarily see myself as Gestalt therapist. That's fine. I think all I'm saying is I hope that you're open to learning what other approaches might be able to teach you that you could use to enhance your primary therapy. That would be, I think, an important piece here. There are different pathways to designing your own integrative approach. One is called technical integration. It used to be called technical eclecticism. That's Arnold Lazarus's term for this. What it basically means is that you take techniques from many different theories and systematically, hope you hear that, systematically you apply them to a theory that's more your own. That's part and parcel of developing an integration approach. And technical integration means that you know the theories because you can't integrate that which you don't know. You have an appreciation for different techniques from the different perspectives, and you have a rationale for why you use a certain technique. And if a client were ever to ask you, why did you have me do what you did? Why did you have me write a letter to my parents that I didn't send? You should be able to explain the reason for your technique. So technical eclecticism is one route to integration. Another is called theoretical integration. And theoretical integration is basically taking two or more therapy approaches and combining them and integrating them. And that becomes more challenging because Arnold Lazarus would say that if the two theories aren't blendable, if there's something that they're basically incompatible, then you're going to have problems in the integration. So he says it takes a great deal more skill and knowledge to integrate theoretically. But there are a lot of good examples of that. We saw mindfulness-based stress reduction, mindfulness-based cognitive therapies. Those are examples of integrating different theories to some extent. You're integrating psychoanalytic concepts, behavioral concepts, and the mindfulness approaches. There's a third route to integration. It's called basically common factors. And the research has shown that there are some common factors. One of them is the client, him or herself. That's a common factor. Another factor is the client's motivation. Another common factor is the therapist's aliveness as a human being, as a person. Another common factor is the quality of the therapeutic relationship. And it seems to be, the research shows this, that common factors is what accounts for change, not the technique of the therapist per se, not the theory that the therapist is using and utilizing, but more what do these therapies have in common. Maybe you'll discover, maybe it's no surprise, that a lot of these therapies shared some common ground. Like I kept talking about the relationship and the importance of the therapeutic relationship, the I-thou relationship, attention to multicultural issues, attention to what the client is bringing to the relationship. All those are common factors that have to be attended to if you're going to do effective therapy. So that's one way of integrating, of thinking, how can I draw from the different therapeutic orientation some things that they share in common? An example of that would be many therapies, several of them, talk about empowerment of the client. How can I begin to think of how I can help clients become empowered? Another common factor that would be very important to think about is how can I draw more on strengths and the resources that clients already have and that are bringing to the therapy endeavor currently, you see. So you can look maybe at what the therapies share, what overlapping ground they have that you would like to select and incorporate in your own brand of therapy. And again, I hope you hear this. This is so important. Maybe in the beginning you'll be intimidated with this, but I hope you begin to think, how can I be my unique self? There's one of you, and each of you has certain talents that you can bring to your work. And what I think is so important is to discover, what are my uniqueness? What's my own unique characteristic that I can bring to my work that will enhance my work? See, that's the basis, I think, for integration, one of the bases. Another is you really need to be familiar with the research literature. What does the literature say about what works? That's extremely important, very important if you're going to develop an integrative factor. You don't want to just go by personal hunches or personal whims. And certainly what you don't want to do is become a non-thinking, eclectic, that doesn't have a rationale for integration. That's sloppy, haphazard practice. You don't want that, because that's not really integration at all. That's just pulling bits and pieces, but not knowing why you're doing that. So that is not what I'm talking about. Also, another very important variable in developing an integrative approach is to pay attention to the client that sits before you. I talked about solution-focused brief therapy. Some of the solution brief therapy folks will say that they have a very simple set of a few questions that they ask every client after every session. How did the session specifically go for you? What worked and what didn't work? What is helpful and what's not so helpful? And to what degree is our session helping you move closer towards attaining your goals? Now, that's called practice-based evidence, as opposed to evidence-based practice. Do you see? And this approach is basically saying that you can enhance your work with clients by being open to systematically gathering feedback on every single session. Don't be too open and just say, well, how did this go? But you can ask a very specific question and be interested in the answer and say, you know, our work together depends upon feedback from you, and then my willingness to tailor and customize therapy to suit you personally. I need to know from you what's helpful and what's not quite as helpful. So please, let's talk about every single session in terms of what specifically you're getting from it and how we can work better as a team. So an integrative perspective really sees how we can work collaboratively more as a team effort than most of the other approaches. What are the advantages of psychotherapy integration? Because one approach is not sufficient to address all the needs of our diverse clients that we're going to be working with. Some clients need more of a cognitive approach. Sometimes clients need more of an emotive, and some clients will need more of a behavioral approach. So thinking, feeling, and doing are all important components and parts of an integration, and an integrative approach allows us to draw from literally all or most of the standard therapies to construct really a new therapy for every client. Isn't that an interesting way of looking at it? You almost invent a new therapy for each client. At least you're trying to customize and tailor your techniques to every client. And that might be true in a given session. In one session, a client might need more emphasis on cognition. And then towards the end, they may need something more behavioral. Maybe in the beginning, it's more emotionally focused, okay? And then towards the middle or the end of the session, there might be more emphasis on cognition and talking about the emotion aspects. So with the same client in the same given therapeutic hour, we may be drawing upon different aspects of different theories, more the thinking, the feeling, and the doing within the same hour. So don't just think about using different therapeutic strategies with different clients. Think about the same client from week to week and each session being open to what does the client need right now from me at this point in time. Another thing I'd like to at least comment upon about integration, and I've said this with the various theories, but not all of them, is we need to integrate a respect for the client's broader culture, culture defined in the broadest way, not just culture from a racial, ethnic standpoint. That's part of it, but we need to be attentive to factors like gender and how gender is playing out in the therapeutic process. Sexual orientation is a very important part of the multicultural aspect. We need to be aware that there are diverse ways of living, and that plays out in our constructing our integrative approach. Religion is a part of and spirituality, not for all, but for many clients, and if we don't attend to religious and spiritual differences, we're leaving something very important out. So let me shift to another dimension. What about incorporating spirituality and religion into your therapy practice? I suppose I really want you to hear this. I don't think it's our role ever to impose or to bring our brand of spirituality or religion into the session with a client, unless you're advertising as a particular religious type of counselor working in a particular setting where that's appropriate, and with the client consent. But generally, when you're working in a general community agency, we cannot bring our own religious, spiritual issues into the counseling session and impose them on our clients. Doing so is unethical and I think also ineffective. But I do think there's a lot of room for having dialogue, discussion, conversation surrounding spiritual values, meaning in life. We talked about that many times with the Adlerian, the existential, the person-centered, acceptance and mindfulness approaches, ACT, acceptance commitment therapy. What is the meaning and purpose of your life? Well, that entails bringing in a spiritual perspective at times. But again, I think we want to consider always doing this in an inclusive way and never in an impositional sort of way. And I just want to say that, we don't have to leave out a discussion or conversation of spirituality and religion if it's important to a given client. Now, the challenge of developing an integrated perspective, it's a lifelong endeavor. And again, I hope you see that you're not going to have this all wrapped up after one course or even with your master's degree. And sad to say, even when you get your doctorate, you're not going to have it all put together. This is a lifelong endeavor. But that's what is exciting about this. You can continually learn by taking new workshops, reading, going to presentations with the different therapeutic approaches, and learning to borrow systematically from each of these approaches in something that you can customize to your own particular personality and brand of working with therapy. There's a lot more we could say, but I want to kind of summarize the whole program and say, I know you're also having access to the STAN counseling sessions where I worked with STAN with every different theory that I've been lecturing on. Hopefully, I said this in the beginning, but I want to reiterate it. My suggestion is to look at the lecturette first, and then maybe look at the STAN counseling session to see it in application. And I hope you'd read the chapter, whatever book you're looking at, more than once, several times, to really absorb the content. And also, I hope you could personalize each of these lecturettes, each of the chapters, each of the theories, to kind of think about how can I use these theories and pieces of these theories in constructing my own life and reconstructing my life. So I think you can use this video series, all these lecturettes. Hopefully you may want to see them more than once as a review when you finish the entire book, and towards the end of the course you might want to look at each one of them again to pick up the pieces you missed and to kind of get reacquainted with this. So different learners learn different ways. Most of us learn experientially too, by actually doing it with supervision and practice. But the reading is a very important dimension. Familiarizing ourselves with these theories is critical. And then seeing it on all these lectures and the doing part with Stan is a good way, I think, of actually bringing some of this together. But I want to encourage you to be patient with yourself and realize that you're a work in progress, and that the more you can work on yourself as a person, the more I think you'll see fruits of this towards becoming a better therapist. So don't think about how I can learn a new technique. Think about how I can become a more effective human being. How can I do in my own life what I really hope my clients will do? And if you can live a life that's one that you're proud of, and that you're enthusiastic about life, and that you're open to life, and you're interested and engaged, I think it's bound to have spill-off into your work as a professional. So I come back to that idea again, that you cannot separate you, the person, from the professional, that they're intertwined. So my main pitch is, don't just work on yourself as a professional. Don't just work on skills and knowledge. Do work on that. But in addition to that, work on who you happen to be as a human being. Work on becoming more open and accessible and more willing to listen to your clients. And also, see it as a challenge, how can I use my clients for my own personal growth too? And what I mean by that is, how can I learn from them the importance that I'm never a finished product. Your clients never have it all wrapped up, and hopefully you can see that you won't have everything wrapped up and finished and tied into a neat bow. So that's why it's important to be open to talking to colleagues, to getting supervision, to writing in your journal, to getting personal therapy from time to time, and to getting ongoing supervision as a way to enhance your work both professionally and personally. And I hope we'll meet each other at some conference. Feel free to come up and say that I heard you lecturing on these topics if we meet each other at a conference, and I expect some of us will. Many of us will, because I saw a few of you just about a month ago at a conference, and I expect I'll see some of you in the future. So do come up and introduce yourself and give me some idea of how this is working for you. And I wish you the very best of luck, and just realize you don't have to do it perfectly. There's a lot of room for learning by doing, so long as we're open to learning from less than perfect performances. And hopefully you'll enjoy your work, and you'll never get tired of it. Hopefully you'll see that this work can keep you alive, and it can be fun. It doesn't have to be drudgery. And if you're not having fun in life, then maybe you ought to rethink that, because that'll be a critical component of this too. So the final few thoughts I have is, realize that developing your own counseling theory and practice is a lifelong endeavor, and it won't be accomplished anytime soon. And that's what makes this work exciting, that we're never finally finished. And it's always new, always evolving. As we evolve, our work evolves, and there's a sense of continual awe and excitement. So good luck.